So I want to thank everyone for being here. So definitely I wanted to start with thanking Dr. Harris-Thurton. So I know that she's worked hard and as well as Dr. Hoare to really get this conversation going. And this is a very important conversation for several reasons. One is, you know, as we all know, we're in a pandemic situation and travel really isn't allowed. However, that doesn't mean that international programs stop. And so we have to envision new ways that we can create these collaborative conversations. Um, and these conversations are meant not only to discuss among students, to disseminate best practices and knowledge gained, but also as a way to do more cross-cultural education. How do we then implement these best practices? Because the way that we do that is going to be different from one country to another. And so I wanted to say thank you again for being here. Please participate. Everyone who is an attendee, feel free to type in questions. The question and answer box is open. And so if you have a question, you have a comment, please feel free to chime in as well. And for everyone that doesn't know, I'd like to first introduce Dr. Lynette Menezes. She's an Assistant Vice President for USF Health International, and she oversees international programs across the colleges of medicine, nursing, pharmacy, and public health. Um, and after Dr. Menezes does a quick introduction and a welcome, Dr. Thurton, if you would like to introduce yourself, and then also Dr. Hoare afterwards.
Yes, good evening. My name is Lydia Harris-Thurton. I'm a pharmacist by training, and I hold a master's degree from Creighton University in Omaha, Nebraska. I'm a lecturer in the pharmacy program at the University of Belize. I've been here since many years, 20-something years. And I'm currently the chair of the Allied Health Department, which consists of the pharmacy and Bachelor of Medical Laboratory Sciences programs. So it's a pleasure to have this opportunity to meet with you. I have a few of my students here with me, pharmacy students. These are students who are in what we call the cohort group. They have graduated and have been practicing pharmacy. However, at the time they went through the program initially, we were at an associate degree, but they function as pharmacists and they are registered as pharmacists under the laws of Belize. So now they've come back to get their bachelor degree. So they're doing a transition program, completing additional courses and credits to get a bachelor of pharmacy degree from the University of Belize. So I have Crystal Perfy, Natasha Smith, Emily Manzor, Delbert Altamirano, Brianne Tillett, Rondine Reynolds, and Berlene Caetano. Berlene's camera isn't working, but these are our students and they're coming from different areas of the country. So thank you for having us.
Yes.
So I just wanted to go ahead and welcome everyone. My name is Lynette Menezes. I know that Jesse just introduced me, but on behalf of the University of South Florida and on behalf of our Senior Vice President, Dr. Lockwood for USF Health, as well as the Dean of the College of Public Health, Dr. Donna Peterson, I wanted to welcome each and every one of you to the Student Conversation series. So this is one of our first events with the University of Belize, and we look forward to having many more. We have a very robust international program at USF Health across the 4 colleges of medicine, nursing, public health, and pharmacy. And our College of Public Health has been one of the leading colleges among our 4 colleges in terms of our global health efforts. We have a very strong research area in malaria and other vector-borne infections as well. And we have a strong infectious disease clinical departments as well in the College of Medicine. And we have a range of programs for students, including student exchange, as well as ability to, opportunities to do research across the world. So we do a lot of different things. And Dr. Hoare is one of our global health faculty as well, who has done a lot and has a substantial number of students that he mentors. So we are so excited that all of you are here this evening. I know it's a Friday evening and I appreciate all your time. And I think this will be a very exciting event for all of us to be able to exchange ideas between groups. And we look forward to, at some point when COVID is hopefully a memory, which is going to be a while, I think, but that we would be able to visit. And I know I visited Belize, it was in 2015, and I have very, very fond memories. I just loved, I spent a week there and loved every minute of it. So I'm hoping that there would be an ability for our students in both universities to go back and forth and meet and exchange ideas as we would now do virtually, and hopefully it will be in person soon. So with that, I'm going to ask Dr. Hoare now to say a few words and then to introduce the group from USF.
Thank you.
Sure. Thank you, Dr. Meneses. And again, welcome to our Belize partners. I've worked with Lydia before in the past for a couple of years, I think, if I may recall, during my tenure there at UB. I'm Ismael Hoare, as you mentioned. I'm currently the lead for the concentration in global health practice. Most recently, I was also the lead for the global disaster management, humanitarian assistance, and homeland security program that we have offered here at the College of Public Health. I've done quite a bit of research in my work that is focused in either Central America, the Caribbean, or South America. And we have, for the many years, taken a number of students to several countries in Central America, Belize being one of them, and I'll speak to that shortly. With us, we have the president of the Global Student Association, Bashir Rowell, the vice president, Bradley Nabor, and with us as well, Tina Din, who are joining us for this presentation. So I just wanted to say welcome and thank you very much for being a very supportive partner with the work that we do here at USF Health and College of Public Health in particular.
Thank you.
Jesse, did we introduce Tina? No. So I also have one of our staff who has been,
Yes.
Tina Din, who's also here. She coordinates many of our international programs here at USF Health, and you will all have the opportunity if you decide to come to USF from Belize, you will have the opportunity to meet with her, and she will help and assist with that arrangement.
Yes, she's the one that sent all the invites out. So
Okay.
she's definitely very instrumental in our office. So Dr. Thurton, would you like to start with your presentation of the topic?
Yeah. Yes, just a brief overview of the pharmacy education at University of Belize and how it has evolved over time. The program started as an apprenticeship program training in the 1940s, where persons were expected to work uninterrupted under the leadership of a medical doctor or government pharmacist for at least 3 years, and then they would be examined to become dispensers. That evolved into a diploma program that was kind of a hybrid between the apprenticeship and having formal classes where students would spend about half the time in a classroom setting and the other part in the government dispensary, learning the practical aspects of pharmacy practice. This then moved into an associate degree program where it was 3 years for associate degree with all the pharmacy classes, including pharmacology, therapeutics, pharmacokinetics, all the essential pharmacy classes involved. And it also included a 16-week internship rotation through different practice areas such as hospital pharmacy, community pharmacy, drug distribution and management, and compounding and manufacturing. We then in 2017 launched our Bachelor degree of Pharmacy Took many years for us to get to this point, but it is a 5-year program of pharmacy classes. Students either come to us straight from high school or from junior colleges, where they would first do their support classes and then go into the pharmacy specific part of the program. The final year of the 5-year program is dedicated to internship. They do actually 24 weeks of internship, again, rotating through pharmacy, hospital pharmacy, community, drug distribution and management, compounding, and then they have an elective where it would either be in drug inspectorate unit, clinical pharmacy, drug product development, etc. So this is basically the layout of our program. In terms of the curriculum, University of Belize has now for several years been participants in the Pan American Conference of Pharmacy Education. And this involves collaboration between schools of pharmacy through Central America, South America, the Caribbean, and North America. And so the curriculum that was used to develop the current Bachelor of Pharmacy program is the PAHO Basic Pharmaceutical Education Plan and Professional Competency document that was used to help design the current curriculum. Along with this, we also utilize the Global Competency Framework from FIP in determining the relevant competencies for us. Of course, to go from the associate degree to bachelor's, we went through the program review process and involved internal review, external review, involving all the stakeholders to find something that fit Belize, but yet prepared students to practice outside of Belize as well. Because as pharmacists, wherever we work, there are certain things you have to do. It doesn't, change from one jurisdiction to the other in terms of the professional aspects and the knowledge base that is necessary. So the curriculum does consist of all the typical and essential pharmacy courses, the pharmacy math, pharmaceutical calculations, pharmacokinetics, pharmacology, therapeutics, all of those. And then our program has always been very practice based. So it has always been very focused on students gaining experience in the workplace. So as our students enter our program, we begin with experiential learning where they are expected to gain certain number of hours in a pharmacy practice setting. It's not for credit. And as they move through the program, the number of hours they spend volunteering and being exposed to pharmacy practice increases. Our students are also involved in therapeutic rounds at the referral hospital in Belize City, where they would go on rounds with the physicians, nurses, and other members of the healthcare team to begin to experience from that aspect the entire process of determining patient care and therapeutic care plan. The internship, as I mentioned before, is an integral part of our program. It continues to be. And for the students who come back after having done their associates, like the ones on the panel today, they have already done 16 weeks of internship before going on to becoming pharmacists. So when they come back now, they do a clinical practicum to be introduced to the aspects of clinical pharmacy, again in the referral hospital in Belize City. We, as a young university and program, we recognize there's a need for us to build research culture. And so fortunately, we have members on staff, faculty members who are very much involved with research. And so students are encouraged and involved with research throughout the program. And this allows them to build that experience. So if they move further into their studies, they already have that exposure to research, but it also helps us to create baseline data for Belize. So this is one thing that we're very happy about. And recently in the last year alone, we've had several publications. So a unique feature of our program as well is a pharmacognosy component, which is the study of medicines from natural sources, including plants. So we know that a lot of programs across the region don't have this component. Again, we're lucky to be able to have this as a part of our program, especially given, you know, the rich nature of what we have in terms of medicinal plants in Belize. These are just some examples of the recent publications that we have had in the last year. And all of these involve both faculty and students that have come through the cohort program. So this is something that we really hope we can continue to build on and to begin to have collaborations with other institutions as we continue to build a research culture for our university, for our program, and for Belize. So that's in a nutshell what we do, right? In terms of regulations, in Belize, pharmacy practice is regulated under the Chemists and Druggists Act. We have, or the legal requirement for a sign that hangs outside our door, it says that we are licensed to sell drugs and poisons. And this act has been in place since the 1940s. It is, there's some loopholes given the, you know, the current technological era we are in. So we are always lobbying to have it updated. We also have the Antibiotic Act that requires prescription for the sale of antibiotics. Again, it is something that we work hard at enforcing. We do have a Misuse of Drugs Act that controls, that regulates the sale of controlled drugs, and the Food and Drug Act, which regulates drug registration for medication coming into the country and the requirements for that, as well as the regulations for facilities to operate as pharmacies and as drug wholesale and distribution businesses. So those are some of these are the main regulations under which we practice in Belize for pharmacy. And so our students going through the program, they're aware of the legal requirements and what is expected of them when they graduate. When they do graduate, they do have to sit a licensing exam to be registered under the Chemists and Druggists Act in Belize. So that's what we have. This is just a picture of our famous blue hole up close and personal, and a picture of Half Moon Key. Thank you.
Oh man, I'm ready to go visit.
We're going next month, so. All right, so how do you want to proceed? Do you want me to go ahead and give my just a brief overview?
Yes.
So I'll just share a couple slides, and then I'll for us to go through. Let me see if I can.
That was a wonderful presentation.
I think Mr. Nolito on share your portion. I think is still sharing.
And the number of publications you all have is very impressive.
Yes, and that's you know, in the last year and a half. Yes.
Yeah, that's fantastic.
Yeah, being from the Bahamas, that's like a lot. The last publication I found for the thing I'm working on in Dr. Hoare's class was from 1984. So like I understand for Caribbean country what that is.
Yeah, we really are trying hard to build, you know, local information and data, baseline data.
And we're supposed to add one more to the group because we just submitted a publication on violence against women in study that we did in Belize. First of all, again, Thanks very much. I noticed that in having attendance, Mr. Abubakar and Mr. Chiroma, and I just want to say a personal hello to both of them. I don't think I've seen any other recognized faculty member in the
I
list.
think our dean is online as well.
Our dean is online. Okay,
Dr. Johnson.
yeah, Dr. Johnson. I have fond memories working with Mrs. Johnson, who's actually was one of my mentors as a newly minted dean for the Faculty of Nursing and Allied Health at the time. We at USF have a long history on working in Belize. As Dr. Meneses pointed out, the USF Health has done quite a bit of work in the Caribbean and Central America, and the College of Public Health in particular has done quite a bit of work in Belize. And one of the things that I remember that we started, but before I go to that, I just want to briefly describe our College of Public Health MPH program. We have one college-wide MPH degree, and we have 19 separate concentration. In some of them, we can combine the concentration. For our purposes, the program that I'm leading is the Global Health Practice Concentration. And our program is subdivided into 3 areas. One is the college core that comprises of 18 credit hours. The Global Health Practice program has 15 credit hours, both in theory and in practice. And then we encourage our students to seek a certificate in a particular area of expertise that they want that is near and dear to their professional heart. And so we have persons who have combined, for example, global health, disaster management, global health, infection control, global health, maternal and child health, etc. So we do encourage our students to, in a sense, craft portion of their program. As I mentioned, Belize College of Public Health has been collaborating with Belize for quite some time. And the earliest program that they had that started with the University College of Belize at the time in 1998 was the master's program that we had. And in this picture, you'll see, you may recognize some person in there. We have Dr. Koyi. We have that, let me see, I have something in the way. Peter Allen, Victor Rosado, former dean at the University of Belize, Trudy Tillett, former dean Mrs. Leolyn Swift, and others that are contributing to development. So we have a long history of collaboration with the Faculty of Allied Health. I'm sorry, I believe it's Faculty of Health Sciences. And we continue to work on this. And our nature of collaboration has been as to strengthen the portion of practice that we have based on organizational fit through educational programs, community outreach, individual placement, and of course, research. Or the research that we have conducted with the work of our students has been in community health assessment, nutrition assessment, hospital mass casualty response, refugee, reproductive health. The work that you have done in each and every case has been to leave what we did with the Ministry of Health or with the University of Belize. So for example, if we collected data, a copy of that would be provided to the Ministry of Health for their follow-up. And of course, we publish on that information. We have had placements, individual placements to Belize, at Belize Medical Associate. We have had individuals who have gone to Independence Village Polyclinic. At the Ministry of Epidemiology, we had one of our students who did the first study developing the cancer, analyzing cancer registry that the Ministry of Health had, and they provided developed a report for the Ministry of Health. Western Regional Hospital, one of our former students developed actually a program to reduce back injury in nurses working at Western Regional, but also not only at Nursing Regional, but also leaving a program that could be expanded to the other regional hospitals. And of course, we have worked with National Emergency Management Organization and the National AIDS Commission. We have conducted the past field school where we took persons who had a background in global health or in epidemiology or biostatistics or in environmental health at the time in 5 different programs. and develop a cohort of students who brought in their strength for practice. And we did our work in Belopan with San Martin area, right behind UB in Belopan, and we moved to working in Santiago Juan layout in the western part of the country, and also did some work in Punta Gorda. Part of it was to establish an opportunity for students to actually practice what they have learned, practice their passion of public health. And so we always look forward for opportunities where we can collaborate with the University of Belize as well as with our partners in health to conduct research, promote educational opportunities. And these are just a couple of pictures that one of our students had on their downtime exploring as well portions of Belize. So I just wanted to give a brief overview of our history of the College of Public Health, working with the Faculty of Health Sciences in Belize, and hopefully we can continue to build on this relationship and this opportunity that was presented through the Global Health Student Association is extremely important for this continued collaboration. So I just wanted to give a brief overview, and at this point, I would like to see if we can open the conversation to questions that we may have from our students, as well as from the students from the panel students. One of the things that I keep mentioning with my students that I teach in global health practice is that when we look at opportunities abroad for practice, we need to take into consideration that programs are not as developed in the normal or formal sense that we would have here within the U.S. And some of the programs, for example, are a misnomer in terms of comparison speaking, because I believe that the pharmacy program has far more credit hours requirement at the associate degree level than a current bachelor's degree program here in the US. And they're also practicing at a much higher level than what we would expect in terms of responsibility for persons who graduate with a bachelor's degree here within the US. And then, of course, with the work that has been done by Ms. Thurton, Ms. Abubakar, and Mr. Chiroma in terms of trying to push for a bachelor's degree in that pharmacy program, it really gives you, if you were to compare them, something close to a master's degree level for pharmacy. So there are opportunities where there are some, we're on a level playing field, if I may say so. And I believe that the research component that has been provided, that inserted into the pharmacy program, is an extremely important program. So my first question, given that background to start the conversation, would be how can students from here in the College of Public Health collaborate with our students at the Faculty of Health Sciences, be it in pharmacy, nursing, med lab, or environmental health, in terms of public health research projects? And I could ask, could I direct this question to any of the students who are participating? Can you?
So Dr. Hoare, can you repeat the question once more?
So we're looking for platform for collaborations, and research is a major component of the pharmacy program. And normally we tend to be very narrow in our focus without recognizing that pharmacy is part of public health, of a much more larger public health trust. And so what are some opportunities for collaboration from our students here at the College of Public Health and pharmacy, or the other programs that are currently at the University of Belize? What are some of the opportunities for collaboration that may be possible?
I could make one suggestion. I'm from USF. I'm representing that side. I would say when you tackle the opioid crisis, so that's something I worked on last year for my interprofessional experience. And so I think that ties in a lot with pharmacy because the opioid crisis is like it has to do with opioids, which are drugs. And so I think maybe we could work on research related to maybe that and even a mental health aspect to get some people interested in psychiatry and the mental health aspect of health as well. So I think that would be a great way to get many different health areas involved in one.
Rondine, you want to add to that?
Hi, good evening. Rondine Reynolds here. I have been a practicing pharmacist, like Miss Lydia mentioned, for 20 years this year.
I remember you.
Um, yes, I was just going to say it. I remember Mr. Hoare from UCB days. So thanks for the opportunity here. And to answer the question, I would say a huge part to intertwine the public health sector would be um, a little bit more hands-on. We do a lot of hands-on here in Belize, and our work description years ago used to always include a little end of the line statement that says, and any other duties that may be assigned from time to time. And here we are, like we pharmacists, we're the front line that the patients see all the time. They come to us and we would have to be pushing them to, okay, I know you don't like the doctor, but go see the doctor because this is something a little above what we should be trying to address on our own. So there's a lot of day to day, like we have the diabetic association, we have the kidney association that deals with those patients, the diabetic for one, because they always have little complications. A little pinprick can turn into something else. So I believe, like Miss Lydia mentioned, our clinical aspect of pharmacy will really help us a lot in that. But the public health area would intertwine a lot in gaining experience in how to handle those situations. Because while we do a lot of patient counseling in pharmacy, while we're trained a lot with that, even from the associate's degree program years ago, and now even more with the bachelor's degree program, there is still a little, um, what's the word that I'm looking for? I would say we're not,
More strengthening in those areas.
yes, yes, we definitely could use, and pharmacists now are branching out. First patients had to travel miles and miles to get to a health facility. But with the program now, a lot of people have studied, so we have pharmacists all over the country, and pharmacists are even now going into the rural areas. So the more knowledge we could send them out there with, the better it is. Not for them just to have the knowledge, but for them to impart that knowledge and help the patients in their community, especially the rural communities, because those are the patients who don't just jump up every day and go to the clinic. They will get a pinprick. They will know that they're diabetic, but they will not leave because, oh, I don't want to go to the hospital. I don't want to be admitted. So if the pharmacist would be in those areas, would be more knowledgeable in all the little aspects and how to deal with those little day-to-day things, um, I believe they would be a great asset to all patients in those areas, because a lot of them tend to leave certain conditions until it's too far gone before they come into the urban areas and say go to the hospital to be admitted or whatever the circumstance might require.
So if I'm hearing you correctly, we are what we can see is collaborating for our public health student might be uh, conducting formative research to determine why uh, diabetic patients are not seeking hospital or understanding their health seeking behavior, and which is extremely important, particularly for maintenance of um, medication and management of chronic conditions. So that's something that our public health students can partner with the knowledge that the pharmacy students have in terms of how patients access medication or patient access healthcare, to understand and develop a health education program that's extremely important for patients. So, Brad, would you like to add something to that?
Sure. So kind of what I was hearing, it sounds like there could be good opportunities for diabetes management programs, kind of chronic illness management programs to help alleviate. It sounds like you guys deal with a lot from patients on that kind of front. So it sounds like management programs, prevention programs would maybe help reduce some of the burden that you guys have. It's just kind of my first thought on that.
Good.
Just to add to what Lachey mentioned in terms of an area of research that could involve all the different areas along the line of the opioid crisis would, for us, might be work in terms of alcohol, substance abuse in terms of alcohol, self-medicating, sorry, and of course, marijuana use, which, you know, like everywhere else, the clamor is for it to be made more available legally and things like that. So work along that line. So while we might not see and hopefully never see the level of opioid abuse and crisis that you see in the States, there are other substances that may, so another, that would be an area where collaboration could work and could involve different fields as well, not just pharmacy and public health, but nursing, etc.
If I may ask a question, and this is for the students. So I like to usually start off. So this is a very good interprofessional activity, right? So we have public health, and we have pharmacists that are working together to find common ground. So this is a two-part question. The first part is for the students at the University of Belize, and the second part is for some of our students to respond. For the students from Belize, what is public health? And for the students from USF, what is pharmacy?
So could we start with the our students here, what they understand is pharmacy?
Yes. I think getting everyone together on the same page as to what themes are will get us, I think, to a good location where we start to really look at our common grounds, because I think there's more than you think. So as Dr. Hoare mentioned, for our students, what is the role of a pharmacist? Or what is a pharmacy? What is pharmacy?
So kind of the first thoughts I can come up with what I'm thinking pharmacy is I'm trying to build upon like medication dispensary. I know that's not, what it is. I would say like disease managing professionals who have a great understanding of medications and how they interact with the body.
To add to that, I would say this is based off of my background, because my first degree was in chemistry, and I took a pharmacokinetic class and I took medical chemistry. And so I would say there are people who basically, they construct drugs and modify them, and they even do research to create new drugs to mediate different situations. So for example, earlier, I got my COVID vaccine. I went to the pharmacy, and the pharmacist, they would have made the vaccine based on whatever instructions they were given, and it was basically, they produce it. So a compounder would be someone who would create the actual medication, and these medications would be used to manage diseases, as Brad said. So another example I could give that's realistic, my dad and most of my family suffer from hypertension and diabetes. They go to the pharmacy regularly to collect their drugs so they can go and basically combat the disease they have. And it's just a regimen to manage, as Brad said.
How did our students do? Students from Belize, what would you add?
For me, public health is about
Gilbert, go ahead.
In Belize, we refer to pharmacists as drug experts because we're responsible for the handling and educating of medication. So we technically are drug experts. But they hit the nail on the head. They got it right.
Good job. So now the question goes to the students from University of Belize. What is public health?
When I think of public health, I think of the science of protecting and improving health for people and is. So I would think that a public health professional would be someone that's responsible for doing research on and identifying areas of improvement for public health.
I'd like to add to what Brianne said. To me, the term public health sounds very general. I think probably a lot of professions might fall into public health, but definitely sounds like a lot of research, a lot of education to the public and communities about stuff that affects the public in relation to their health.
I think Delbert wanted to add something. I think you're on mute, Delbert. You're muted.
We're not hearing you, Delbert. Not hearing you.
Okay, in the meantime, Delbert figures that out. I'd like to add that to me, public health seems like something in medicine that encompasses the general way of decreasing disease burden throughout the world. So to me, public health talks about nurses, pharmacists, med lab techs, all medical professionals, the epidemiologists, all medical professionals in trying to improve the way of life for individuals globally. So and yeah, that's basically what I think it is.
All right. Go ahead, Rodin.
Okay. I would also like to include that my thought of public health also includes getting out there in the public, with the public, getting them to understand the importance of their health. Because it's not just to say, oh, I'm going to leave myself and eat as I please and do as I please and don't exercise and end up with diabetes and hypertension just because we can go to the pharmacist and get some pills that is supposed to fix that, or the importance of how to take care of themselves before they reach that critical point. We've always been pushing that prevention is better than cure. So public health really deal with that prevention part as it pertains to the public before it deals with the medical personnel that deals with the curing or treatment part.
Nice. How did the students from University of Belize do?
They did good.
Yeah, I think that was that was right on. My kind of go-to definition for public health is it's the science and practice of promoting and protecting the health of people in the communities where they live, learn, work, and play. So I feel like everything everybody said encompasses it. Especially someone said that it was very broad, and I would second that. It's very broad and it includes so much more than just kind of the health side, so the medical side of everything. Yeah,
totally agree with Brad, because basically there's like kind of 3 pillars, and that's what they have on the College of Public Health. They have research, policy, and practice. And so you all said 3 of those. So those are basically a lot of the things that we do in public health, and you can encompass so many different aspects of health and life, because even in Dr. Hoare's global health class, I learned about traffic accidents and injuries, and I would have never thought too much about that in terms of public health, because we try to think more about infectious diseases and non-communicable diseases when you just, think about it firsthand. So it's just so many things that you could touch. So they did an amazing job. Y'all are, pretty good. I love this University of Belize. We got to collaborate with y'all and get involved with the Bahamas too, please. We need to have research like y'all. Please help us.
I also wanted to add, to make an observation that in one of the responses that Rondine pointed out, when you look at what a pharmacist does in Belize, and this is only one of the many professions, nurses, med lab, etc. They encompass a bit of health education. health education to, encourage patients to abide by the treatment for their physician, guidance from the physician, or their medication that they're taking. But it also highlights an area where we are deficient in terms of focusing on more health education components in how we address health issues in Belize. And so that's where I see a very important role of pharmacy students, where they can identify gaps in our health care system, and where the public health student can come in and fill in those gaps in terms of helping us understand patient behavior. You pointed out that some person might be reluctant to leave the rural areas or seek health care. So we want to understand, why is it? Is it that because of distance? Is it because of travel? Is it because when they get to the clinic, it's already closed, or the appointments are closed? And so we need to look at a variety of components which public health, working hand in hand with these allied health professions, can be of extremely good use for improving healthcare in places like Belize, like Bahamas, and then we're seeing in the Caribbean as well, other Caribbean countries and other Central American countries. So,
I noticed in the chat, someone was asking if pharmacists in Belize work in public health education. Natasha, you want to respond to that? Kind of explain where you work and if there are any public health education aspect to what you do. Natasha?
Hi, good evening. Hi. Where I work is a clinic setting. It's like a mini hospital, you can say. So what we do is we get patients in, the nurse check them, they see the doctor, and they come to the pharmacy. At the pharmacy is where we would dispense and do many patient counseling there. And if any other questions arise with the patient, we will be there to answer the questions them. And we try our best to do health talks to the patient. We also would give them little handouts, like for example, I gave some the other day ways how to use the asthma inhaler properly, because some of them were not using it correctly. So we would give them handouts and let them read them so that they could use it properly. Just little health talks now and again in the clinic, just to keep them abreast with what's going on in the world. That's it.
Delbert? I'm still not hearing you.
Maybe if you try remove the headphones and speak into the speaker, maybe?
Yeah.
You plugged out the headphones?
Oh no, Delbert. So for anyone who was in the attendees list, if you do have questions or comments, feel free to type them into the Q&A, and we can have people answer.
So could I ask a question here? Now that I think we are on the same page, and thank you, Jesse, for putting us there. One of the questions I would have and this I think goes for both our students and as well as our pharmacy students in Belize. COVID-19, of course, gave us through a huge wrench into the normal way of life. What changes or adaptations did you have to make as pharmacists to adapt to provide healthcare service to patients wherever you work? Whether I would like to see if, I think some of you work at the hospital, some of you work at clinics in the rural areas, if I'm not mistaken. How was that different? And I think some of you also work in the private care, private practice. How did you change to the COVID-19 environment? And for our public health student, what different changes did you see of public health practice that you hadn't anticipated as being a part of the global health practice program? So if I could ask the pharmacy student first, their observations.
To answer this question, I'm a pharmacist working at a community pharmacy in the northern area of the country. When COVID hit, it was really hard. We were just piled with a lot of work. We had patients coming in to stockpile. It was a very busy and crazy time. And we adapted so quickly. We didn't even know what was happening. We just had to make up our own policies, kind of like we were used to having patients come in and have that relationship with them, and that suddenly had to stop. We were using a window service, which kind of is like a bad thing in a sense, because it's very hard to provide the patient counseling that the patient needs. There is no private area that we could talk to them. So we started, offering patients phone calls. Do you want to call the pharmacy? You have any problems with your medication, call us. We're available to talk about how to manage your condition, how to take the medications. Any questions concerning that? We also had to start taking in prescriptions through the phone. Doctors would have to call in, email in, because patients couldn't really travel to the clinics or hospitals. And that was a big change. But we adapted. It was a challenge, but we managed to make it work, and we're still figuring things out as we go along.
Would somebody else also respond?
Good evening, sir. Berdine Caetano here. For us at Central Health, for us at Central Health Region, just a slight difference has changed, but nothing much, because for us, we work within the city and throughout the rural area. So for us, we have a list of all the patients, all the chronic patients. So what we did was we collected their information, their phone numbers. We asked them what medication they're on, and we package off the medication. We send them on different mobiles for that day. So nothing much has changed except for us to wear our protective gears and so forth, which we are handling pretty well right now until something major than COVID comes along. Like Ebola. I don't know.
Yes, Berlin works in the Central Health Region, and they do a lot of outreach and into rural areas in the Belize district.
Okay.
Where I work, it's pretty slow paced, so we didn't have to make any major changes per se. The only thing we implemented was a 1 person at a time rule, and the wearing of mask is mandatory in Belize now, so no mask, no service basically. We install wash hand basins outside of the facility, and there's also sanitizers at the receptionist inside the pharmacy. We can still have our one-on-one patient counseling sessions with each patient, like I said, because it's not crowded, so it's pretty slow, and we still managed to get the job done. But for those that didn't want to travel, we did take phone call prescriptions from the doctor, and then we used the courier services to ship them to the different districts.
Yeah.
For us at the I work at the referral hospital called Fusionary Memorial. We had the opposite effect. It got slower for us. We went from having full wards to having like 10 patients at the wards, because everybody was afraid to come to our hospital, since we were the one that had the isolation unit for the COVID patients. And they tried at best to keep patients out of the hospital. The patients that stayed within the hospital were critical patients or patients that needed to be monitored. Within the hospital, we have to wear masks are mandatory, sanitization is mandatory. If you have to come into the hospital with appointments only, and so we're just getting back into the swing of things where appointments are open, their visiting hours are back to normal, and we're just trying to get back to some sense of normalcy.
Crystal works at a private facility and Brianne at the referral hospital.
Okay.
For me at the health center, at the clinic, it got super busy because
Which health center
everybody.
is that, Natasha? Which health center?
I work at the health center, Matron Robert Health Center.
Okay. Gotcha.
It was super busy because as you have a cold or a cough, you come to the clinic. So we had multiple people, persons come to the health center just because they have cough, cold, or, you know, like signs of COVID. So we had multiple people come there, multiple testing happening, and then the stress of waiting time with other patients there. So it was at first was like kind of a chaos until we had to educate them on how the procedures will go now. Have to wait outside and then come inside, and have to wash your hands before you come inside, take your temperature, and then we had like 4 persons in the clinic at a time due to social distancing. So people were very upset about how long they had to wait, but that's the way it had to be with the social distancing, no? But everybody got to see the doctor in the end.
Okay.
Your pharmacy is also an NHI pharmacy, right, Natasha?
Yes, ma'am, it is. Yes.
So
we had
National Health Insurance. Could you explain a little about that?
NHI is partly government. With NHI, if you're 5 years and under, over 60, the medications you receive are free. If you're pregnant, it's free. So if you're between the age of like 6 to 59, then you have to pay a co-payment, which is not much for your medication. And also with NHI, lab services and x-rays are also at a minimal price when you have the NHI, no?
Okay. Thank you very much. Could I ask or public health students as to some of the experience they had, particularly related to COVID-19?
Yeah, so at the beginning of the kind of when it started, the pandemic started last year, I feel like pretty much all the public health graduate students, including Lachey and I and Dr. Hoare, went off to work for the health department's contact tracing, working on their various contact tracing programs. The biggest thing that I kind of noticed is that we weren't prepared for it. When I was working at the health departments, there was no set standardized process for contact tracing, and we constantly had things changing every day. So a lot of disorganization. I stopped working for them for a while ago, so I can't speak on what they're doing now. I don't know if it's more streamlined, but a lot of the issues that I faced were administrative on the contact tracing part, but also something that I was kind of surprised about are a lot of the people that we would call and we would talk to, how the pandemic was affecting their mental health. I thought that was something I didn't expect. Not that I didn't expect it, but I didn't think about it. But a lot of people were having a really hard time. A lot of people lost their jobs and were experiencing homelessness. So just a lot of health disparities that started with the pandemic, or not started, I would say more were exacerbated by the pandemic, and just became more apparent to me, at least. So that was kind of my experience contact tracing and working with COVID-19 with the health departments.
I'd say in particular in Florida, because we would have worked for the Florida Department of Health, it was very disorganized. It would be so difficult to deal with a patient if they were in a different county. Like just switching that person to a different county would be like an arm and a leg. It was like, it was so difficult. And every day when you walked in, it's a new procedure. I'm like, y'all got to give me a paper for this, because I don't even know what you're talking about at this point. Like, the site would look different, the system. Yeah, that was kind of difficult. And I think the compliance in Florida, if y'all watch the news at all, CNN, they was on the beach, not our age, just a little younger than us. They were on the beach. They were doing whatever, living their best life. They was like, all my classes online, we gonna do this at the beach. They were just doing whatever. So it was a lot of lack of compliance on our part, because, you know, public health, we try to prevent and stop the spread of disease, but that was pretty much, I'd say, the biggest barrier. There was a lot of mental health issues. And I think something that caused some of the issues too was because people would feel guilty, because they would have believed, because they don't know for a fact, that they were the ones who brought COVID-19 into their household, and they would have caused their family member to either have a poor health outcome or, you know, just suffer something in general. And for me, it was kind of twofold. Like, I had to deal with the impact in the Bahamas and the impact in the US, because my entire family, like I saying this whole time, is in the Bahamas. That's where I'm from. And there, things progress differently. When there was a lot of cases in the US, the cases weren't really in the Bahamas yet. And so the phases, or like, it just moved differently. So right now, my biggest barrier is I got to research everything about AstraZeneca, because nobody in my family want to take it. So that's my biggest barrier right now. And I took the vaccine. So in terms of the US, I'm good. But oh, we got so much misinformation. That's another thing too for public health, because the misinformation makes our job so hard. And once somebody sees one thing, they're gonna hold on to that forever, even if it isn't true. You still got people talking about blood clots and stuff with AstraZeneca and arguing with me. So, you know.
Yeah.
When it
me,
comes to contact tracing, did you guys find that the people were forthcoming with their information, or were they holding back with where they were? Were they at the beach?
Oh my God.
They lie so hard.
People lie to you, and it's like they don't even try. Like, you can tell they're lying. Like, when they say, I haven't been in contact, when we would call them and say, who have you been in contact with the last 14 days? I mean, granted, we did ask a lot of personal information, and towards the end of my stint at the health department, we stopped asking some questions that may seem a little intrusive, but we would ask people who they've been in contact with, and then we would ask them for the names, and that's usually where they would shut down, and they would say, I haven't been in contact with anybody, I haven't been anywhere. So it's like, where'd you get it then? You know, so they're lying to you. And then on the other side of that, though, you'll have some people that will tell you their whole life story. I used to have a guy, he got COVID, recovered. He was dealing with a lot of issues, but he used to call the health department and ask for me every single day, and would just talk to me about his life. And I was an ear for him to listen to, or for an ear for him, to listen to him, whatever. So I didn't mind, and that was kind of one of those situations where I noticed like a lot of mental health problems. Like, he was having a lot of trouble in the pandemic, but yeah, so people weren't very forthcoming, and then some people were a little too forthcoming, I would say.
Yeah, Brad, you are 100% correct. And they ask you for your name so they could call you back. They'd be like, and what's your name again? And they say, wait, spell that. So that's how you know they're gonna call you again. And wow, some of them would lie. I'd be like, have you been in contact with so-and-so? And they'd be like, no, I don't have COVID, I haven't been in contact, hang up. And then they blocked you. So like, when you call back, they blocked you. So it's like crazy. But I mean, I didn't take anything personally. And then I also did a lot of stuff with the testing. So where I went was more of a rural area in Florida. The population was lower. And so we only had 3 of us who was sent down there to help. And so we did a lot of different things. So with the testing site, there would be some people without a mask on. And then by the time they come close to you, they'll say, oh, and I have a lot of symptoms, but they don't have a mask on. They coming up. But that's why you have to make sure you have on all the PPE when you're doing the test and stuff. Like, I just thought that was not being forthcoming, knowing that you're sick, and then just coming around so many people, because we couldn't turn away people who didn't have a vehicle. Well, at least we didn't do that in this small rural area. So usually for the testing sites, it's drive-through. So you have to have a vehicle so you can maintain social distancing. But you couldn't deny those people because there was only 2 health departments in that whole county. And so you can't really just deny people, especially if they're saying they have symptoms. So that was a big barrier as well.
Yeah, as Brad had mentioned, we were involved in the contact tracing, and I was also volunteered for that component there. And at the initial stages, it was quite interesting because the first week we were having like 100 cases a day. Then all of a sudden, within less than a week, it went to 700 cases a day. Then 1,200 cases. It was kept jumping in terms of people we needed to contact trace. So for me, lessons from at least for persons, I was monitoring the situation here in Belize as well, but also looking at the level of volume that I think Belize hasn't observed. And if you were to contact trace 1,000 plus cases that are coming in daily, and so that's a matter of volume. But the most important part that I was looking at was kind of um, how should I put it, mildly upset, was that we're from the focus in Belize, we're looking at it from a punitive perspective. If you do not answer these questions, you're going to be fined, you're going to be this, threatening individuals to do so. And that can lead to more behavior that will not be helpful in providing us with relevant information that we can actually do some good public health work in tracing individuals, in understanding what are some of the challenges. And the other component that I hadn't thought of when I was doing contact tracing is the impact on mental health, not only on those that are being impacted by COVID, but also by the health professionals who have been to deal with these individuals. I mean, it's not easy listening to or trying to trace individuals who are experiencing a wide variety of issues. And it can be also heart-wrenching. So you will see the best of people and you see the worst of people, but we have to keep focusing on the simple fact that we're there for public health purpose, not there to judge individuals, not there to make a hasty observation of individual, but trying to understand why is it that people are behaving the way they're behaving. Why is it that people are reluctant to wear masks? Why is it that persons, even though they're seeing COVID numbers rising, be it in Belize or be it here in Florida, they're still congregating without taking any safety precautions. So those are part of, I think, that opportunities where the pharmacy students can see from their observations of how patients behave. And I see some gaps, and I try to ask the question, simple question, why? And then asking that question, or public health students can partner with pharmacy students to start to answer these questions and come with a much more structured approach, a logical approach, a scientific-based approach to address those issues. AstraZeneca, we should not be surprised of the vaccine hesitancy. That has been growing. It's not new. It's growing in Belize. It's unfortunate because AstraZeneca, it does prevent contraction of severe COVID and prevents you from getting being hospitalized. So it's obvious that the vaccine is works best. It's a good vaccine for the country. However, we need to understand why is it that go to the core of the matter. So why people are hesitating. And so I think that gives us a good closure to this session. I think we're going beyond the allotted 1 hour that they were given. And so I just wanted to say that I think there are very good opportunities for our students to partner and to collaborate into research project. And obviously the pharmacy students have shown that they have the capacity to conduct research with their publications, as we've seen. And our students here are certainly welcoming of an opportunity to practice practice their public health internationally, and then of course enjoy some of the Caribbean Sea that we saw earlier. And that doesn't happen in Bahamas, so Bahamas doesn't have very good.
Gonna get this
islands.
argument again. It's a continual argument in his class. Like, do you believe Have you seen Atlantis? Have you seen us? Come on.
Yeah, that's why it's in Belize. Atlantis is in Belize. Everything is in Belize.
And we have a blue hole too. We have a lot of them too.
Yeah, but we have the World Heritage Site, so yeah, let's not go there. This is just the kind of light banter that we have to make sure that we focus on public health. And so I don't know if Mrs. Thurton would want to give a closing remark, and then we can.
Just thank you for this opportunity for the students to engage in this activity, and hopefully it's something that we can build on. I'm sorry Delbert wasn't able to speak. He comes from a different region of the country and has been involved with some outreach activity as well. And I'm sure that he was eager to share his experiences, but hopefully there will be a next time. I hope that our students felt that this was a worthwhile opportunity and experience just to exchange information and to learn from each other. And I think I was telling them last night that some of what they do is in line with public health related services. They might not recognize it as being public health, but and as Ronine said, you know, maybe that's an area that we want to build on and strengthen in our program, because the shift of pharmacy, the shift in pharmacy education is from a primary health to a primary health care module in providing services, and a lot of what we do falls in line with public health and primary health care. So this first opportunity for us to meet and exchange at the level of the students, and thank you, Ismael, for.
May I add? In response to Brad, Brad made a comment about COVID in regards to mental health. Delbert and I are in the group to complete our thesis and research on experiences of healthcare workers during COVID. We were targeting healthcare workers because we tend to put ourselves on the back burner, and we put our health and our mental health on the side just to for the best interest of our patients. So our research is garnered towards hearing from healthcare workers what their experiences were, what the stressors that they experienced during COVID. And we just want to hear from healthcare workers because we tend to just put ourselves on the side and just to take care of our patients.
Absolutely.
Yeah,
So,
you're doing Bradley's love, qualitative analysis. All he talks about, qualitative analysis.
all right, so two quick things before we wrap up, because I know we've gone over a little bit, but I'm very glad. I mean, I think we've discussed quite a few things here. So the first thing is, Dr. Harris-Thurton, you completely stole my thunder, because I was going to say the very same thing to everyone, the pharmacy students. You know, there is a role of public health that you are doing, and you may not realize it, but you are public health professionals in what you do. And so on that line, for both the students at University of Belize and for our students as well, I would task you with one thing. In the next few days, you know, start thinking about where is the merger between pharmacist and public health? Where do you see that reality happening? Are there any gaps that you see that need to be filled where you can rely on a public health professional? And the same thing with our public health students. You know, start looking at or start thinking about where are some of the areas where you cross lines with pharmacy students and pharmacy professionals. And if there's an area of research, I mean, Dr. Harris-Thurton and Dr. Hoare are available to discuss. I mean, if there's ever a possibility to do research and to co-publish your areas of interest, you know, by all means, please write us and let us know what those are, and we can do that. The second thing is I'd like to take a group photo, if that's okay. So if you're on here, please, and you're able to, and you feel comfortable, turn on your camera and I will take a screenshot of all of us.
Hold up, let me fix my hair first. Because there was a couple of them that were
I
at
think
that
you
place.
missed one, Dr. Hoare.
Yeah, okay, yeah.
So, before we close off, maybe some of the other students can mention what they're working on in terms of their research.
Yeah.
Crystal?
Right now, and this is in line with the times, but our group is working on pharmaceutical cold chain management in the country of Belize. So being that vaccines are coming in, it's quite in line with the AstraZeneca vaccine, but we're focusing on the cold chain in general. So the insulins, the erythropoietin, anything refrigerated, how it's managed, if the temperatures are being monitored when imported, when being distributed countrywide, if there's patient counseling happening when they dispense these refrigerated products to their patients, if they are advised how to store them in their household refrigerators, etc. So we're in the process of data collection right now. So we're going to be analyzing the results of that soon.
Emily?
Yes, my research topic is on insulin storage among diabetic patients in Belize. So dealing with storage as well, but in a different perspective with the actual patients who use the medication. We're just trying to see how their knowledge on how their insulin should be stored and at what temperatures they're actually storing it at.
Okay. Rondine? I'm losing.
Our topic is quality of selected oral antihypertensives in Belize. We are in our own little nook. We basically got to import everything in terms of medication, well, tablets wise, injectable wise, because we do not have a pharmaceutical laboratory here. So, and with our porous borders, we face a lot of what ifs. Patient brings brand to us and nobody knows where it comes from. So we knew that it wasn't imported, or brought in the country, the legal importation channels. So we wanted to focus on why is it that some patients are saying, well, yes, I'm taking my medication every day. We know they lie. We're not going to dispute that part, but we want to be sure that the medication that we're providing, both in the public and private sector, are of quality, that we could be assured that if they stick to their regimen, they're getting the best possible care that they could obtain in our little third world country. Because not because we're here means that, we should just settle for second best.
Tasha?
We're in the same group.
Natasha and Verlene are in my group.
Okay, thanks.
Yes, we're trying to do testing on certain drugs to whether to see if it's substandard or falsified. And we also like to beg for some equipment, please. We need it.
Good. Cameras on.
All right, so I've promoted everybody to panelists. So if you are on here listening, you're no longer an attendee. If you are comfortable with it, please feel free to turn on camera, and I will take a group photo. All right, here we go. All right, 1, 2, 3. All right, give me 1 second and I'll take one more because you never know. All right, 1, 2, 3. Perfect. Okay, thank you, everyone. We will send out the link to this video if you wanted to see it again, and also some of the group photos, so you can have that for your records. And we're open to continuing this student conversations. So if there's interest on your end, and if you found it to be, please feel free to reach out, and we're more than happy to schedule another. Thank you, Dr. Harris-Thurton. Thank you, Dr. Hoare, for getting this together. Thank those who participated and those that were attending. So have a
Thank
good
you.
good weekend.
Thank you, guys.
Thank you, guys.
Good to meet you. Bye.
Meet you all.
Bye.
Now I gotta go stress out over this work for global health.
Gosh.
Oh my gosh, his class is killing me, really killing me. Oh, yeah, like we have this assignment due tonight, and I'm not even halfway done. Me and Brad are freaking
You
out.
didn't change the timeline.
You got
didn't
this.
change the time.
Oh, we
They
gonna
got it
try.
easy. They got it easy.
He had me doing basically, I have to do a whole research strategy to reduce hypertension in the Bahamas. I'm doing more work than they doing to prepare for this. he got me doing all these pages.
Yeah.
Oh my gosh.
Good job.
Well, after this, you're going to go back to the Bahamas and be
No,
able to get them writing.
After all this work, I'm about to go to the Bahamas, work on all the non-communicable diseases. Because Dr. Hoare had me good. I'm not even joking. He's good. He's a good professor.
He is. We miss him.
Bye, guys.
I take care.
Bye.
Bye.
Take care. Bye.
Stay safe. Be good.